Good afternoon, everyone. Myself, Dr. Shabihana, second year postgraduate. I am going to present ocular manifestations in patients with chronic kidney disease. Introduction. Chronic kidney disease is a growing global health problem affecting 10 to 16% of adult population in Asia. CKD affects almost all organs of the body, including the eyes. The visual system is affected as a result of uremia, metabolic imbalances, hypertension, or hemodialysis treatment. Early cataractogenesis occurs due to increased intracellular calcium and deposition of calcium in lens. Renal and retinal circulations share similar anatomical, physiological, and pathological features. Hence, assessment of renal microvasculature gives the opportunity to find early microcirculatory changes associated with CKD. Retinopathy is often asymptomatic in treatable stage. If not diagnosed early, it could increase the risk of vision loss. My aim is to study the occurrence of various ocular manifestations exhibited by patients with CKD. Inclusion criteria: age group above 18 years, all patients with CKD of any etiology. Exclusion criteria: critically ill patients, pregnant women, post-renal transplant patients, patients who are not willing to participate in the study. Materials and methods: institutional ethical committee clearance and informed consent was taken. It is a prospective study. A total of 100 patients were included in this study. Place of study is at NRM Medical College. Relevant ocular history and history regarding CKD and other systemic illness was taken. Visual acuity was tested by Snell and Start. Anterior segment by slit lamp biomicroscopy. Dilated fundus examination was done by direct or indirect ophthalmoscopy, slit lamp biomicroscopy with 90D. Dry eye evaluation was done by Schimmer's test. IOP by applanation tonometer. Visual field analysis was done by perimetry, B-scan, and OCT was done wherever indicated. My results are: in this study, a total of 100 cases of CKD were included. Most of them were in the age group of 40 to 60 years. Most of them were male, constitute 72%. Ocular symptoms in patients with CKD: asymptomatic in 25%, and most common ocular symptom is defective vision, constitute 55%, followed by lid swelling, constitute 9%. Least common is redness, constitute 1%. Visual acuity: most of them had vision more than 6 by 24, constitute 42%, followed by less than 6 by 60, constitute 34%. Systemic diseases associated with CKD: most of them had diabetic and hypertension together, constitute 36%, followed by hypertension alone, constitute 26%. Least common is CLD, constitute 4%. Anterior segment findings: normal is 26%, most common is cataract, constitute 45%, followed by periorbital edema, constitute 9%. Least common is orbital cellulitis and preceptive cellulitis, constitute 1%. These are the pictures showing preceptal cellulitis and orbital cellulitis. Posterior segment findings: normal fundus in 14% of patients, and most common is hypertensive retinopathy, constitute 30%, followed by diabetic retinopathy, constitute 26%. Least common is papilledema, glaucoma, and macular hole, which constitute 1%. These are the pictures showing grade 3 hypertensive retinopathy with macular star, and high-risk proliferative diabetic retinopathy, papilledema. OCT showing cystoid macular edema with lamellar macular hole. B-scan showing retinal detachment. Visual field showing arcade scotoma, and OCT showing inferior RNFL thinning. The discussion: CKD is the end result of multiple systemic diseases or primary renal disease. Defective vision was the most common ocular symptom in our study. So in our study, diabetic and hypertension together was the main cause of CKD, which constitute 36%. Similar results were found in the study by Dr. Tasneem Khanam et al. In our study, 44% of patients had cataract, which is the commonest cause of defective vision. Similar results were found in the study by Divya Jairaman et al. This study is an attempt to assess the ocular status and complications associated with chronic kidney disease. My conclusion is: it is intended to highlight the importance of ocular examination in all patients with CKD, irrespective of presence of ocular symptoms, so that necessary treatment or advice can be given before they cause irreversible visual impairment. These are my references. Thank you.